And I'm going to focus now on the final key for today's podcast. We will continue the other keys with the next podcast. So this is key number 5, which is average revenue per new patient. This is a reflection of your case acceptance rate. Increasing revenue relies on 2 metrics, new patients and average revenue per new patient. In this particular key, this 5th key, we will discuss the second half of this formula, increasing average revenue. There are 2 basic components that contribute to average revenue: the size of the purchase as well as the frequency of visits. So what influences the size of purchase? Well, the size of purchase basically refers to the idea that patients do more than they just come in for the exam. So they're not just coming for the exam and the checkup. Now, if you convert the exam to a hygiene appointment and perform any necessary work, both basic and significant, then the amount spent per patient increases. So that means their average spend increases. When you do this, it increases your average revenue per new patient metric, hence your overall revenue. Now, the following are key factors that determine whether you can do more treatment on patients and boost this number. Number 1, recommending additional treatment. Most dentists and hygienists significantly underpresent treatment that patients either want, need, or could benefit from. Number 2, so you want to present more. Number 2, patient trust. Have you intentionally developed a high level of trust with your patient? Are you intentionally employing the 6 principles of influence in your practice to establish that level of trust? You want to establish that trust and confidence right from the outset. The 6 principles of influence are based on the book from Robert Cialdini titled Persuasion, the Science of Influence. The 6 principles are reciprocity, liking, social proof, authority, scarcity, and commitment. It's vital to have a thorough understanding of the 6 principles of influence if you want to develop high trust with your patients. I do recommend Robert Cialdini's book, Influence, the Psychology of Persuasion. Number 3, a high case acceptance rate will boost your average revenue per new patient. Your team's effectiveness in case acceptance is critical to boosting the size of patient purchases. Tracking case acceptance overall for the practice, as well as for individual providers, is also very important. Whatever you track will improve. If you don't track, you won't improve. So start tracking to establish baselines. Then you can set goals to improve the case acceptance. One common practice metric that most practice management software tracks is the annual revenue per active patient. The higher the number, the higher the size of purchase. Examine this number, track it, and establish goals to improve it. This is an easy metric to track that doesn't require any additional effort or tracking. Number 4, team education. It's essential to regularly educate your team on all the procedures performed in the office and also educate them on the benefits to patients from these treatments. If your team doesn't believe in the value of what you do, then the patients won't either.